Perfect. Welcome, everyone. We are thrilled that you're here today to learn more about Certiport's new health sciences careers certification exam, which is medical administrative assistant. I am Dominique Delbar, and I'm a product marketing manager here at Certiport, and I am thrilled to be joined by some amazing colleagues and guests of the webinar today. Today we have Lilia, who is a product manager here at Certiport, and we have David Manning, who is a content development manager. So we're really excited to have them. They played key roles um, in the ideation and development of this new program and the new certification. And so really excited to dive in to discuss the efficacy behind the exam, why it was developed, and how it will help prepare your learners for their future careers in healthcare. With that being said, I'm going to pass the mic over to Lilia to tell us a little bit more about this new exam.
Wonderful. Thank you so much, Dominique. And thank you all for joining us today. As Dominique mentioned, I'm the product manager for the Health Sciences Careers Medical Administrative Assistant exam, and I'm excited to spend some time with you today and tell you a little bit about it. So the healthcare industry is huge. It employs about 16 million people and has a really great growth rate of 13%. And one thing to note about healthcare is that healthcare really is focused on kind of building the employment pipeline and getting people in early and moving them in throughout the healthcare pipeline to different jobs and things like that. Starting wage for this particular role is between $17 to $20 per hour. So really, really solid foundation for somebody who's wanting to start their career as a medical administrative assistant. Program is really focused on preparing learners for those entry-level positions within the healthcare industry, while the exam itself is titled Medical Administrative Assistant and is certainly a very great exam to help someone get their foot in the door for that role. It is also a really great foundational exam for any type of medical role that somebody wants to pursue in this at a foundational level in the industry. It's a 50-minute exam, about 40 to 50 questions, selective response, and someone needs a 70% minimum passing grade to pass it. This exam is designed for individuals who want to work in the US. And that's important to note because a lot of the exam is focused on HIPAA, which is a medical privacy law in the US. There's a lot of interpersonal questions woven in throughout the exam as well that are based primarily on US. And there might be some instances in other countries where the interpersonal focus might be a little bit different. As I mentioned before, the healthcare field is booming. So there's a lot of growth in it. There's a lot of people that are retiring, a lot of need and desire to keep people moving in from the start all the way through and throughout their careers. The growth rate is faster than the average for the other employment sectors through 2032, the growth is expected to be about 13%. I'll dive in a little bit more into the skill groups and other topics that we're going to cover in the exam, but really the focus is that it lays a great foundation for future healthcare careers. So with this exam, we are offering the full pathway solution. So we have our learning products from our wonderful partners. MSI More Solutions has a course created for this. LearnKey is going to have one coming out very soon. And then we have Geometrics practice as exams as well. I'm actually doing the MSI course right now, and just want to say that it's a really great course, a lot of scenario-based questions. So really a great exam for, a great course for an exam like this, where there's a lot of situational based scenarios. The exam objectives that we cover off on are things like office procedures, healthcare terminology, billing knowledge, communications, and medical health records. I'll dive a little bit deeper into what these include. on that last page, there is a link included for the test drive. So that gives you kind of a sneak peek into some of the questions that you might expect when you are taking the exam. So what we did was we worked on researching different healthcare pathways, healthcare courses, and talked to individuals that are working in the field to come up with these exam objectives. The exam objectives really reflect the skills that someone is going to need to perform when they're out in the field. So office procedures is going to cover off on things like patient information, emergent and non-emergent patients, scheduling patients, and handling different types of appointments. Billing knowledge, so payment sources, insurance cards, billing terms. Terminology is going to cover off on different types of tests and organs. And then billing knowledge focuses again on the payment sources and things of that nature. And then interpersonal communications, that dives into, for example, if you give a scenario to a candidate with a patient issue, they're going to know how to resolve that issue. They're going to know how to de-escalate that issue. Different types of bias that might exist that you'd want to avoid in the job role. And then medical health records, which is going to be really focusing in on handling medical records requests, the right procedures there, what to do, what not to do, how to store, maintain, and transfer data securely. When we were creating this exam, we really focused in on a lot of HIPAA. So there's a lot of HIPAA woven in throughout all of these different skill groups, all the objective domains. We also focused in on interpersonal skills, just because that's such a huge part of this job role and just a huge part of being in the medical field in general. All right, so now we have a sample question. I think we can just pop in whatever answer you want or whatever answer you agree with into the pretend like you didn't see that into the chat, but I'll read off the question. Which medical practitioner specializes in the management and treatment of the physical, mental, and social health of people from birth to young adulthood? Obstetrician, oncologist, psychiatrist, or pediatrician? Let's see. All right. Pediatrician is the answer here.
Awesome. That was a really great overview, Lilia, of the new exam and why, a little bit of background behind it, how it'll benefit learners. A follow-up question for you, as we've talked a little bit about why this exam was developed, how did feedback from both educators and industry professionals play a role as this, as you're developing the idea of this exam?
Yeah, that's a really great question. So we started our market research with not just looking at job data, but also looking at and talking to different CTE directors from states that have these healthcare pathways. So we asked them what was important to them. We asked them, what should an individual know? What gaps are you trying to fill that you're not currently seeing certifications available for? And that's how we came up with this exam. And then just in general, our exam building process is very rigorous. So we started with pulling in subject matter experts from different backgrounds so that we have a very diverse exam that's focused on the job role, with a psychometrician that's also present throughout the exam building process.
That's incredible. It is incredibly rigorous to get to that point. So thanks for diving into that. And David, I know that you played a major role in the development of the content of this exam. You were the lead content manager. How is this exam going to prepare learners for the jobs? That's ultimately the goal, is helping learners get jobs. So how will it prepare them?
So Lilia briefly touched on the fact that we use subject matter experts when we build our exams. And the view has always been, you need the best experts to build the best exams, right? So we reach out to a diverse group of people. We make sure that they're experts in terms of, we have people who are in the job role, medical administrative assistant. We have people who've hired for the job role. So, employers of medical administrative assistants. We have people who are in adjacent job roles who have to interact with medical administrative assistants on a regular basis. And we have teachers who are teaching the subject matter right now. And we bring all of them together, and we have them all lend their voices to build the best exam we can. And their feedback allows us to hone in on just the material that's important for that person to know. Sometimes you'll get like a good question that, like, you're like, oh, that's such a good question to ask. But then, someone will point out, like, hey, as an employer, I don't care if the student knows this or not. And everyone's like, yeah, the employers don't care if the kids know this or not. And we're like, okay, it was a great question, but it's kind of gone, right? We want to focus in on what's going to let the students stand out and do well in their job hunt for a medical administrative assistant job or an adjacent job.
Yeah, that's really helpful. I love how you showcase too how, I mean, there's so many good questions that you could ask, and it could easily become like a significantly longer exam that asks all these things.
Mhm.
But what I appreciated about it is that you really zeroed in on what is most relevant for this exam, for this job role, or similarly adjacent job role. So I really appreciate that
Yeah.
in terms of how you helped lead in the development of that. When
Yeah.
you're developing this exam, what standards or frameworks did you use to ensure that it aligned with the industry expectations?
So we looked at a number of different factors. We mostly, with this exam, we looked at a lot of what laws are going to be pertinent to someone in the role, like HIPAA is so important in the United States. Um, if they don't understand HIPAA and its significance, that is going to be a major detriment to them. So we made sure we had HIPAA covered well. We also had to look into if someone in this role is going to be dealing with insurance a lot. So what insurance information do they need to be aware of, right? And we also had to look at what are state standards for different states that are going to be offering this exam. We had to make sure that we're covering in the exam the standards that those states are saying we need to hit, as well as so it's always a balancing act, right? Of hitting what the state education requirements are and what employers are looking for in hiring an applicant. We have to balance those two things to make the perfect exam.
Yeah, that's perfect. And I think that's really beneficial for educators as you're looking to
Yeah.
see like, okay, so is this exam going to work for me? Does it meet my state requirements? But then also going past that, I mean, the learner is not always going to be in the education system, and they are eventually going to hopefully go out and take their educations and their careers to the next step. And so I appreciate that the industry standards are also very much taken into consideration.
Before
Um,
I came to Certiport, I was a teacher in the classroom, and I know my number one goal was always to make sure my kids were prepared for the job market. And so that's, of course, our number one goal is to prepare them, but we also want to take those teachers into account of, hitting their standards that they need to
yes.
hit. Yeah.
Yeah, no, absolutely. That
Yeah.
completely makes sense.
Mhm.
And when you're developing the exam, how do you make sure that, because you touched on a few things that, I mean, there's HIPAA, there's insurance. When developing the exam, how do you ensure that the questions don't only test the conceptual knowledge needed by a learner, but also the practical real world skills that are needed for success?
Well, that comes down to, again, having the best experts in. I also went to a couple of different conferences. I went to, I live in Florida, and I went to the Florida Association of Career and Technical Educators and spoke to a number of teachers in that audience about the exam and got their feedback. But then we brought in all these subject matter experts in, and made sure that we were getting a diverse set of feedback, and that the feedback was all leading us down the same path, right? We wanted to make the best exam we could. Um, and in the end, we made sure we got there with a diverse set of input, and by making sure that stakeholders, both in the educational space and in the business space all could be happy with the results of what the exam was.
That's perfect. That's incredible with how much attention to detail was put into it to ensure that it was meeting the needs. So thank you
Sure.
for that. And I know that, I mean, right now, and this is a question for Lilia, or for I guess both of you. I mean, right now, 2024, we know what the standards are, and the exam is meeting that. But as standards and as industries and education, or yeah, educational standards evolve, what do you do to ensure that the exam continues to maintain the rigor and relevance?
I can answer that if you want, Lilia.
Yeah.
So at Certiport, we have a policy where our goal is to ensure that candidates are always ready for the workforce, right? So we're constantly trying to achieve this goal by reviewing our content. One thing that I think a lot of teachers don't know is that when you leave feedback on an exam question, that gets reviewed. We take that feedback and we build on that to make our exams better. We always want our exams to be as good as they can be. And so we're constantly looking at that feedback. We're also bringing people in and looking at the exam on fairly regular intervals to ensure that they're relevant and up to date with evolving technology and standards and laws, because we always want to make sure that we're asking candidates fair questions and questions that the marketplace cares about, right? If a question isn't something people care about anymore, then we're not going to ask about it anymore. You wouldn't ask them about, VHS tapes or, CRT televisions anymore on a modern exam. You would be asking them about more modern things. So we're always trying to stay on the cutting edge to make sure that our exams are relevant.
That's amazing. That's perfect. Thank you so much for diving into that. Um, I love the example of VHSs.
Yeah.
I mean, yeah, and I also really appreciate your note too on when someone leaves feedback, that feedback is taken into consideration to make sure that our exams are always relevant and we're always making sure that they're as up to date as possible. So thank you. And
Yeah.
thank,
And if I could,
yeah,
sorry,
absolutely.
I could just add, one additional data points that we use for our exams. I think everything you think that David said is 100%, accurate and exactly what we do. We also bring in a lot of job data, so we have a lot of resources here that aggregate data from different job websites like LinkedIn, like Indeed. We also take that into account as well, just because if there's a major shift in the duties that, for example, like if, medical administrative assistants have to add something else new to their job role in 2025, we have data that kind of tells us that. And then we'll pair that with all the other pieces that David mentioned with talking to SMEs and looking at feedback and things like that.
Yes, excellent. I'm really glad that you brought up that point too. Thank you, Lilia. And thank you guys so much for your time. Really appreciate your time and your expertise. I'm personally thrilled about this exam. I think that it's going to do great things for individual learners who are looking to explore healthcare, or they're looking to become medical administrative assistants. I think it'll really help them get their foot in the door and be prepared for success in the job market. So thank you so much. If anyone has questions about anything that we discussed today, please reach out to your Certiport representative, or we'll send out a recording after this email or after this webinar with the link to the recording, and you can always respond directly to that email, and we are more than happy to help. Thank you again for your time, and hope to talk to you soon. Thanks all.